Researchers at Aalto University recently spent a year tracking 2,000 people who adopted AI companions. They didn't rely on lab-controlled surveys. They analyzed the unfiltered language of public Reddit posts to see what happens when users believe no one is watching. The data shows a distinct divergence. As engagement with the AI companion increases, language indicating social connection to other humans plummets. This happens because the AI companion is designed to be frictionless. It is always patient and never disappointed, which quietly raises the perceived cost of real-world relationships. When a human friend asks for effort or empathy, the AI starts to feel like the easier, more attractive option. Over months, this creates a trajectory of isolation. The damage is a slow, invisible drift away from the people and professional networks that are actually equipped to intervene in a crisis. This behavioral drift has triggered a massive regulatory response. In a single week, 14 states moved forward with bills aimed at AI mental health, signaling a rapid, coordinated attempt to draw boundaries around the technology. At the same time, venture capital is returning to the sector after a 2-year slump. Hundreds of millions of dollars are flowing into behavioral health, but the money is no longer targeting the apps that dominated the last cycle. Investors are pivoting toward heavily regulated clinical psychiatric infrastructure and interventional tools, leaving behind the low-acuity consumer chatbots. The influx of smart money into an industry precisely as lawmakers are trying to restrict it suggests a calculated bet on a new kind of business model. State legislatures are acting as the stick in this transition, establishing hard clinical boundaries that the industry is no longer allowed to cross. In the Maine State House, lawmakers recently passed a ban on therapy bots. The law permits AI for administrative work like scheduling, but it prohibits any AI from making independent therapeutic decisions or generating clinical recommendations. Nebraska's Conversational AI Safety Act follows a similar template, specifically prohibiting AI systems from representing themselves as providers of professional mental or behavioral health care. These laws create a high-stakes legal environment for startups. In these jurisdictions, the risk of a bot being classified as an unlicensed therapist makes the old model of unregulated consumer wellness apps economically unsustainable. While states provide the pressure, the federal government is introducing the carrot, a new financial structure that realigns the entire sector's incentives. New digital mental health treatment billing codes from the Centers for Medicare and Medicaid Services create a direct reimbursement pathway. This guaranteed revenue requires strict FDA clearance, blocking unverified consumer apps. It allows companies to bypass the consumer market, building for the permanent payer infrastructure. Investors are moving toward this federal standard because it offers reliable, long-term returns, insulated from the legal risks currently hitting the consumer chatbot market. However, blanket bans on AI therapy face a geographic reality. In Minnesota, a bill to penalize AI psychotherapy has exposed a rift between urban safety concerns and rural shortages. Protecting patients from unregulated AI is a clear goal, but in many rural areas, these tools are the only form of mental health support available. Licensed psychologists in these shortage areas often oppose total bans because they cannot hire enough humans to meet the demand. They see the technology as a necessary tool to manage a crisis they can't solve with labor alone. A total ban creates a void in communities where the human therapist simply does not exist. This forces the legislative approach to move toward a more nuanced model of supervision. The industry is resolving this by building therapist-in-the-loop systems. Here, AI handles high-volume triage and monitoring, escalating clinical decisions to a human supervisor. This satisfies state laws requiring human accountability and unlocks federal revenue by meeting clinical validation standards. Reframing AI as a tool for scaling expertise rather than replacing it allows the technology to operate safely within the existing healthcare system. The transition marks a shift from consumer marketing toward clinical accountability. By bringing AI into the same regulatory and reimbursement fold as any other medical professional, the sector is moving toward a model that is supervised, validated, and integrated.